Documentation and reporting. Question 1. Which of the following does not refer to the process of adding written information to a healthcare record? A. Recording. B. Charting. C. Data entry. D. Documenting. Answer: C. Data entry. Question 2. Which of the following statements about documenting is not true? A. Involves recording the interventions carried out to meet the patient's needs. B. Done in a proper way, it reflects the nursing process. C. Necessary to prove that nursing work was done. D. Nursing documentation can be accepted in both verbal and written form. Answer: D. Nursing documentation can be accepted in both verbal and written form. Question 3. Which of the following are basic purposes for an accurate and complete written patient records? Select all that apply. A. Sometimes used by government agencies to evaluate patient care. B. It is a permanent record for accountability. C. It is a legal record of care. D. They are perfect sources for business and marketing. E. Can be used for research, teaching and data collection. Answer: A, B, C, E. Question 4. This is the main basis for cost reimbursement rates by government plans. A. Critical pathway. B. Minimum data sheet. C. Diagnoses-related groups. D. Patient expense documentation. Answer: C. Diagnoses-related groups. Question 5. Which of the following statements are true regarding basic rules for documentation? Select all that apply. A. Use direct quotes for objective assessments. B. If a charting error is made, draw one line through the faulty information. C. Chart only your own care even when someone else calls you for a late entry. D. Chart after care is provided, as soon as possible, and as often as needed. E. Sign each block of charting with full legal initials and title. Answer: B, C, D. Use direct quotes for subjective assessment. Sign each block of charting with full initials and title. Question 6. Based upon the legal guidelines for documentation, which of the following corrective action is incorrect? A. Never erase entries or use correction fluid. Never write with a pencil. B. Do not record physician-made error. C. Be certain that entry is factual even when opinions are used. D. While logged into the computer, do not leave terminal unattended even during an emergency. Answer: C. Be certain that entry is factual even when opinions are used. Question 7. Which of the following statements about common forms of inadequate documentation should not be included? A. Not charting correct time when events occurred. B. Failing to record verbal orders or failing to have them signed. C. Documentation only in handwritten format even when EMR is mandated. D. Charting actions in advance to save time. E. Documenting incorrect data. Answer: C. Documentation only in handwritten format even when EMR is mandated. Question 8. What kind of documentation is the following? Pain scale 0-10, hand and leg strong to right, weak to left. Skin pink, warm and dry, turgor good, incision to right anterior chest wall erythema or edema. Jane Knight, LPN. A. Cardex. B. Narrative. C. Nurse's notes. D. Shift report. Answer: B. Narrative. Question 9. Which of the following practices could lead to malpractice? Select all that apply. A. Charting interventions in advance to save time. B. Documenting incorrect data. C. Not charting the correct time when events took place. D. Deleting incorrect entries and crossing them out with a horizontal line. E. Not recording verbal orders or not having them signed. Answer: A, B, C, E. Question 10. Charting that is divided into sections or blocks. Emphasis is placed on specific sections, or sheets of information. It also uses graphics and narrative charting. A. Traditional chart. B. Problem-oriented medical record. C. Standard form. D. Cardex. Answer: A. Traditional chart. Question 11. Which of the following is a typical section of a traditional chart? Select all that apply. A. Admission sheet and physician's orders. B. Progress notes and nurse's admission information. C. History and physical examination data. D. Medical administration record. E. Care plan and nurse's notes. Answer: A, B, D, E. Question 12. Which of the following is considered a traditional charting? A. Narrative. B. Problem-oriented medical record. C. SOAP. D. DARE. Answer: A. Narrative. Question 13. What is the difference between traditional and problem-oriented medical record charting? A. Traditional uses an abbreviated story form. Palmer uses an outline form. B. Traditional uses SOAP charting. Problems-oriented medical record uses narrative charting. C. Traditional uses blocks. Palmer uses sections. D. Traditional focuses on interventions. Palmer focuses on interventions. Answer: A. Traditional uses an abbreviated story form. Palmer uses an outline form. Question 14. Which of the following are considered the principal sections of a problem-oriented medical record? Select all that apply. A. Database. B. Problem list. C. Care plan. D. Physical examination and diagnostic tests. E. Referral form. Answer: A, B, C, D. Question 15. active, inactive potential and resolved problems that serve as the index for charting documentation. A. Problem assessments. B. Problem list. C. Database. D. Traditional chart. Answer: B. Problem list. Question 16. In the SOAP format, a briefer adaptation of the Palmer, where is intervention I included? A. It is not mentioned in this kind of documentation. B. Included in the notations under planning. C. Included under assessment. D. It belongs to another format. Answer: B. Included in the notations under planning. Question 17. In the SOAP format, if ever there is a need for changes, where will the revisions R be included? A. Revisions belong to another format of documentation. B. Revisions are not part of this documentation. C. Revisions are noted in the evaluation section. D. Revisions are noted in the assessment section. Answer: C. Revisions are noted in the evaluation section. Question 18. Which of the following statements about focus charting is incorrect? A. Uses the nursing process and the more positive concept of patient needs. B. Focus is sometimes a current patient concern or behavior. C. Focus is sometimes the significant changes in patient status or behavior or a significant event in the patient's therapy. D. Focus can be a medical diagnosis. Answer: D. Focus can be a medical diagnosis. Question 19. Which of the following statements regarding the DARE format of documentation are correct? Select all that apply. A. Data, action, response and evaluation, education and patient teaching. B. Data is both subjective and objective. C. Action combines planning and implementation. D. You need to use all the DARE steps each time you make notes on a particular focus. E. Response is the same as evaluation and effectiveness. F. Some facilities include education or patient teaching. Answer: A, B, C, E, F. Question 20. There are facilities that require narrative notes for each shift to include a minimum of at least 3 entries. Legally, care is not given if care is not charted. This is true, but it is time-consuming and requires excessive detail and a defensive manner in doing so. To solve this issue, what did some hospitals come up with? A. CBE. B. DOA. C. ABC. D. AP. Answer: A. CBE. Question 21. Which of the following formats is included under charting B exception? Select all that apply. A. Pie. B. Soap. C. Soapier. D. AP. Answer: A, D. Question 22. What is the essential difference between pie and soap formats? A. PI is from a nursing process. SOAP is from a medical model. B. PI is from a medical model. SOAP is from a nursing process. C. PI and SOAP are both used for charting by exception. D. PI and SOAP both emerge from the nursing process. Answer: A. PI is from a nursing process. SOAP is from a medical model. Question 23. What kind of notes are taken when charting by exception? Select all that apply. A. Additional treatments done or planned treatments withheld. B. Standing orders and physical history. C. New concerns. D. Changes in patient condition. Answer: A, C, D. Question 24. In charting by exception, what happens after the patient's problem is resolved? A. It needs to be a part of the SOAP documentation. B. It needs to be explained to the next shift. C. It is no longer covered by daily documentation. D. It needs to be transferred to a permanent record. Answer: C. It is no longer covered by daily documentation. Question 25. Which of the following are considered examples of record-keeping forms? Select all that apply. A. Cardex or RAND. B. Nursing care plan. C. Incident reports. D. 24-hour patient care and acuity charting. E. Discharge summary. Answer: A, B, C, D, E. Question 26. A system used to consolidate patient orders and care needs in a centralized, concise way. A. Incident reports. B. Cardex or RAND system. C. Intervention guidelines. D. Nursing care plan. Answer: B. Cardex or RAND system. Question 27. Pre-printed guidelines used to care for patients with similar health problems. A. Nursing care plan. B. Cardex. C. Common illness index. D. Health intervention reference. Answer: A. Nursing care plan. Question 28. Developed by nurses for nurses, it is based on nursing diagnoses and nursing assessment. It also includes goals, plans for care and specific actions for care implementation and evaluation. A. Standardized nursing care plans. B. Plans written in nursing notes. C. Narrative planning. D. Cardex or RAND. Answer: A. Standardized nursing care plans. Question 29. What do you have to fill up when an event transpired is not consistent with routine operation of a healthcare unit or routine care of a patient, or other hospital notification form when patient care delivered is not consistent with facility or national standards of expected care? These events have the potential to cause injury. A. Injury reports. B. Incident reports. C. Intervention reports. D. Implementation reports. Answer: B. Incident reports. Question 30. Which of the following should not be considered when filling up an incident report? A. Do not admit liability or give unnecessary details. B. List date, time and care given to the patient and the name of the physician notified. C. Personal assessment and judgment of incident. D. When charting the incident in the patient's nursing notes, do not mention the incident report. Answer: C. Personal assessment and judgment of incident. Question 31. Benefits of a 24-hour patient care records. Select all that apply. A. Helps eliminate unnecessary record-keeping forms. B. Enhances efficiency because flow sheets and checklists are often used. C. Accommodates a 24-hour period. D. Necessary to maintain a good nursing care plan. Answer: A, B, C. Question 32. Uses a score that rates each patient by severity of illness. A. Acuity charting. B. Charting by exception. C. Critical pathway. D. Traditional charting. Answer: A. Acuity charting. Question 33. One of the benefits of acuity charting is that it provides us with the ability to determine efficient staffing patterns according to the acuity levels of the patients on a particular nursing unit. A. True. B. False. Answer: A. True. Question 34. When does discharge planning ideally begin? A. During admission. B. After admission. C. Before admission. D. Without admission. Answer: A. During admission. Question 35. A systematic approach to care that provides a framework for the coordination of medical and nursing interventions. A. Managed care. B. Critical pathway. C. Acuity care. D. Intensive care. Answer: A. Managed care. Question 36. Which of the following statements about clinical critical pathway are true? Select all that apply. A. Allows staff to develop standardized integrated care plans for a projected length of stay for patients of a specific case type. B. Clinical pathways that delve with cases occur in high volume and are predictable. C. The clinical pathway replaces other nursing forms such as the nursing care plans. D. Charting by exception is usually the method used for clinical pathways. E. The exact contents and format of these clinical pathways are the same among different institutions. Answer: A, B, C, D. Question 37. Which of the following statements about home health care are true? Select all that apply. A. It provides a narrower scope of people for a wider majority of services. B. Requires a whole health care team to work closely. C. Does not demand meticulous and thorough documentation. D. Duplication of documentation is difficult to avoid. Answer: A, B, D. Question 38. Required by the Omnibus Budget Reconciliation Act primarily for long-term care facilities. A. MDS. B. DRG. C. BCG. D. NCLEX. Answer: A. MDS. Question 39. An irate patient tells a clerk, "I have paid too much every time I came to this clinic for a physical examination. I think my medical records belong to me. I need them now." What would be the best response? A. I am required to give you a request form so that I can prove you wanted your records and not just anyone else. B. Your original health care record belongs to the physician. C. One moment, let me make a copy of it immediately. How many do you want? D. I am so sorry, but you really do not have a right to look at your own records. Answer: A. I am required to give you a request form so that I can prove you wanted your records and not just anyone else. Question 40. Patients usually do not have immediate access to their full records. There is one exception. What is it? A. County hospitals such as Stragers Hospital. B. University clinics such as PDI Nursing Lab. C. Federal healthcare agencies such as VA hospitals. D. Municipal healthcare centers such as Oak Brook Health Center. Answer: C. Federal healthcare agencies such as VA hospitals. Question 41. What does HIPAA mandate healthcare personnel with regards to patients' records? A. Privacy. B. Accessibility. C. Confidentiality. D. Availability. Answer: C. Confidentiality. Question 42. What do electronic medical records require from the healthcare personnel? A. Log into the system with a secure password. B. Log into the system with a common password. C. Log into the system with a borrowed password. D. Log into the system with a friend's password. Answer: A. Log into the system with a secure password. Question 43. The government reimburses agencies for healthcare costs incurred by Medicare and Medicaid recipients based on: A. Documentation by the nurse. B. Appropriate physician progress notes. C. Diagnosis-related groups. D. Minimum data sheets. Answer: C. Diagnosis-related groups. Question 44. While doing clinicals, your nurse preceptor had to leave her station immediately due to a code overheard on the public address system. You observed that the computer monitor displayed a patient's medical history. This patient was not assigned to your care. What should you do next? A. Read the medical history for your own education. B. Turn off the computer as soon as possible. C. Print the document to serve as future reference. D. Call your clinical instructor and ask what to do. Answer B. Turn off the computer as soon as possible. It is the ethical thing to do to show respect to patients' confidentiality. Question 45. When is it unnecessary to chart a narrative note? Select all that apply. A. Each time you give a medication. B. Each time a bath is given. C. Each time a decubitus ulcer changes in appearance. D. Each time you assess vital signs. Answer A, B, D.
Thanks for watching. Please comment, like and share.